call the meeting to order. Thank you all for being here and joining us this evening. I'll go ahead and call on Commissioner Lawhon to provide the invocation and Pledge of Allegiance.
Beautiful time of the year we're celebrating, and this is the week of Easter. Yesterday was Palm Sunday, and that's on Palm Sunday, Jesus entered Jerusalem, and as he was entering on the back, I think, of a donkey, palm branches were laid as he was entering the city as a welcome to the city. But in a short period of time, Good Friday rolls around. By the time Sunday happened and he was welcomed as a hero, Good Friday they crucified him. But thank God for Easter Sunday and his resurrection. Please join me in prayer. Father, we are thankful for this beautiful time of the year that you give us. We thank you for the birth of Jesus. We thank you for his willingness to die on the cross for our sins. We thank you for his resurrection. Just be with us tonight as we do the county's business, and let us do the business in a manner that you would be pleased with. These things I pray in Christ's name. Amen. Amen. Please join me with the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Lawhon. Next item, are there any adjustments to the agenda?
Mr. Chairman.
Commissioner Morgan?
I'd like to add one item to the agenda, a proclamation for National Day of Prayer, and make it number 9.
All right. Everybody has their copy of that? All right. Is there a second? All right, a motion by Commissioner Morgan to add National Day of Prayer proclamation as item number 9 on the agenda. A second by Commissioner Furr. Is there? Okay, correction. Item number 8, and then we'll make consent agenda number 9. Is there any discussion on that? All those in favor say aye. Aye. Any opposed, no. Motion carries 7-0. All right, item number 1 on the agenda tonight is the 2020 census presentation. Presenter will be Ms. Rembrandt.
Good evening, Mr. Chairman. Thank you very much, and members of the board, Mr. Lucas, and to everyone present this evening. I am Wilhelmina Rembert, and I am pleased to be here on behalf of the Atlanta region of the U.S. Census Bureau. But joining me this evening is my colleague, Eric Edelheit. Eric is present there, and we are grateful for the opportunity to present briefly to you a little bit about the 2020 census. I'm going to get my PowerPoint here. We are here because we need your help as we go about the business of planning for getting everyone to participate in the 2020 census next year, because every community counts. And so we are looking to our leadership in the community, our trusted leaders, and you, of course, are among them. We are one of 7 states that are part of the Atlanta Regional Office. The Census Center, there used to be one in Charlotte 10 years ago, but now we are one of the 7 states in the Atlanta Regional Office. The goal of the 2020 census this year is to count everyone once, only once, and in the right place, because everyone counts. And of course, you already know the census is mandated by the U.S. Constitution, that we count the entire population of the United States every 10 years, and this has been going on since 1790. And why? Because there is huge impact on our community. And why do we come before you to ask you to perhaps allocate resources to support the 2020 census for two major reasons? One, our political representation, and two, the economic impact that the census data provide. On the political representation side, as you know, our representation in the U.S. Congress is reappropriated every 10 years based on the population count. The census results are also used for redistricting at the national, state, and local levels. And then in terms of the economic impact of the money, I have in my presentation that over $675 billion a year will be allocated to the states and local governments based on these numbers for each year for the next 10 years. Well, we've since learned, since we prepared this presentation, that it's really over $800 billion annually will be distributed to our governments, local and state governments, for each year for the next 10 years. So we want to make sure that we count everyone. Based on the 2010 census, you could tell from the chart there, North Carolina did not have any change from the prior census. We maintained the 13 congressional representatives. Our neighboring states, South Carolina, Georgia, of course, they gained a couple of seats. And there were other states that lost seats. Well, this time our governor has indicated that he wants North Carolina to be fully counted so that we will have our fair share in terms of representation. So we're slated. We believe that we stand a chance of getting at least another seat in the U.S. Congress. And back in, I think, based on data at least from 2015, the George Washington University Institute for Political it's a Political Institute, I'm sorry, conducted a study and looked over 16 major federal programs and how allocations were made to states. And for North Carolina, over $16 billion was allocated over those 16 major federal programs, which amounted to $1,623 per capita. And if you think about our representation and the responses we had back in 2010, we compared the participation rates in North Carolina between those decennials. For Stanley County, your participation rate actually went up 4 points, and that 4 percentage points, and that was good. But we believe that all of North Carolina should be able to get over 80% response rate this time. So if we count everyone once and only once and in the right place, we should certainly be able to do that. For a lot of people, there are concerns about the confidentiality of the data, and we want you to be confident that the data that are collected are protected by the Title 13 the U.S. Code, that the information that we have access to, we are sworn to life not to disclose or provide that information to anyone. We're subject to a fine of up to $250,000 and up to 5 years imprisonment or both if we do that. So we just want everyone to know that the Census Bureau goes out of its way to protect the confidentiality of the information it collects. It's also important for people to know that when census workers go out to collect information, no one should be asking for any personal information like Social Security number or money or donations, or asking for any political contribution on behalf of any party, no information about passwords or PIN codes or anything like that. That is not the Census Bureau's goal. It would not be asking that information. So if someone hears of that, you'll know that they're not representing the U.S. Census Bureau. And some people will also ask, how many ways or why are the census data even important? Well, the census data are used, as most of you know, in many ways to support a lot of the programs and services that you offer here in your county. Among them, they're used for education, healthcare, transportation, social services, emergency response. They're also used for housing, infrastructure, all sorts of programs and services that are central to our communities. But this time, for the 2020 census, One of the major differences from the prior census is that people will be able to respond on their smart devices. They will be able to use their phones, their computers, or their what do we call them, tablets, and they will be able to respond to the census questions from almost anywhere. We expect that the majority of the people will indeed respond that way, but there are 3 ways people may respond to the census in 2020. When the questions come out, people will get a postcard about mid-March of next year. Census Day is always considered April 1 of the decennial year, so April 1 is the target date. They will be able to either respond by a smart device, a computer on the internet. They may also call in. There will be a toll-free number they can call in to answer the questions. And if they don't feel comfortable with either one of those, they can request to have the paper questions actually sent to them. So they could still do the traditional way. But we believe that the majority of people will in fact use the internet. There are target populations that we want to make sure that we reach because they're often hard to count or they're often undercounted, and those are on your screen. We learned from our 2010 census data that many children under 5 were not counted. There are veterans and persons experiencing homelessness, many of our seniors, many persons living in rural communities were not counted, or we did not get the count that we thought clearly existed. Persons speaking English as a second language. So these are examples of persons we are targeting in this census to make sure that we count everyone once and only once and in the right place. We are creating complete count committees, government complete count committees. Governor Cooper has established a North Carolina State Complete Count Commission, and they're dedicated to helping us also make sure we count everyone across the state. He's asking that every county host or create a complete count committee representing the diverse persons in your communities to make sure that they are counted, but they're also people who are perceived as being trusted voices, so persons who might tend to be unlikely or least likely to respond, they will respond because they trust the leaders who are telling them that it is important. And I mentioned that the governor has created this complete count commission. The local government, CCC, should have persons represented from government, from education, from media, from minority organizations, various community-based organizations, faith-based institutions, and the business community. So the Complete Count Committee should have representation from all of these segments of the community. One other thing we wanted everyone to know, and we want your help in communicating to our various communities, is that the Census Bureau is currently recruiting for various jobs in our communities. And although they are temporary jobs, they are very good jobs that persons who are unemployed or perhaps would like a second part-time job or full-time job might have an opportunity to work, because this is a major undertaking every 10 years and everyone in the community will benefit. And we believe that if persons are hired by the census from the various communities, that will also help convince persons in those communities to be counted. So that is the number that persons should call, or they should go to the 2020census.gov/jobs website, and they can see the jobs that are being advertised. Again, I am Wilhelmina Rembert, Partnership Specialist, and Eric is also Partnership Specialist. He works out of the Durham area, but work in different parts of the state. I'm out of Charlotte, and I will be working various parts of the state. And we look forward to working with your staff, Mr. Manager, and making sure that you are supported from the Census Bureau in terms of hosting or creating your Complete Count Committee. We will provide training for the Complete Count Committee and provide materials and information to be shared as needed. That is my presentation. I'd like to thank you very much for your time and would certainly entertain any quick questions if you have any.
Thank you, Ms. Rembert.
Thank you.
Anybody have any questions?
Mr. Chairman, I do have a question. I know you said the response rate was 77%, the last census.
Yes, sir.
How do they determine the folks that don't respond? Surely they have to have some kind of estimation of the total population.
They do, and it's amazing that the Census Bureau, of course, collects data all the time. The population count, of course, comes every 10 years, but the Census Bureau is always surveying the population. And one of the other major surveys is the American Community Survey, which they also use to collect a lot of data. They also can rely on information from local governments. And they get help from local governments relative to the addresses, for example, of where people live. And so they are able to use the data that they collect and other data collected by governments to get better estimates on the actual population. And if people don't respond, for example, in one of the 3 ways that I mentioned, the Bureau has an operation called non-response follow-up, where they will send census workers out to knock on doors. So there are multiple attempts to try to count everyone. They will go out up to 3 times to try to count people in their homes.
Thank you. Any other questions?
Not, Mr. Chairman, thank you very much.
Thank you for coming out tonight.
Guess I should take that down.
Item number 2 on tonight's agenda is the caterer for nutrition program, caterer bids for the nutrition program. Presenter will be Ms. Becky Weemhoff.
Yeah. Good evening,
Good
Mr.
evening.
Chairman, Commissioners. Our department recently went out for bids for our nutrition program, which is a catering of our congregate and home-delivered meal programs. And we normally send out about 175 to 200 meals every day. To solicit as many bids as possible, we ran an advertisement for bid in the Stanley News and Press. And we also sent interest letters to 15 food service caterers, asking them if they would be interested in bidding on our program. 6 vendors requested bid packets, and of the 6 that requested bid packets, we actually received 3 bids back. And the bids that were received and the price per meal for 1- and 2-year contracts are as follows. Golden Corral in Lexington submitted a bid for $4.40 per meal for 1 year and $4.30 for 2 years. Punchy's Diner in Concord submitted a bid for $5 for a 1-year or a 2-year contract. Tiffany's Catering and Events in Albemarle bid $4.48 for a 1-year or a 2-year contract. All of the potential caterers were fairly assessed in arriving at our recommendation. But most of all, we want to make sure that our recommendation would benefit our 175 to 200 seniors that get meals every day. And I'll probably need to mention that about 60% of those that we serve are home-delivered meals, and these are the county's most frail seniors. They're still at home, they're homebound, and we're sending them a meal, and often they use their meal that they receive for lunch for supper as well. And the volunteer delivering their meal is sometimes the only person that they see every day. So therefore, we've got their benefit foremost in our mind. Anyway, we visited each kitchen. We consulted with the environmental health inspector for their professional input. We considered the 2 lowest bids to see what kind of cost that would be to our program. And we also looked at the experience and the volume that each of the caterers were currently handling, because our program will amount to about 50 or 50,000 meals a year. Because of all these things that were considered, we are making a recommendation that we go with Golden Corral of Lexington as a caterer for the nutrition program at a 2-year contract for a bid price of $4.30 a meal.
Thank you, Ms. Weemhoff. Are there any questions, comments from the board?
Mr. Chairman,
Mr. Morgan?
I just have one. In our thing, it shows year 1 at $4.40 and year 2 at $4.30.
So is that correct, or is both years 430?
No, that is correct. In other words, this one caterer, Golden Corral, is saying if we go with a 1-year contract with them, their price would be $440. If we go with a 2-year contract with them, it would be $430.
Oh, okay, so it's not, okay, I read it wrong. I had it read, it was dropping the second year, so it's, if you do a 2-year contract, then it's 430 for each year?
Both years, yes.
Okay.
Yes.
Mr. Chairman,
Mr. Long.
Ms. Weymouth,
Yes.
in our contracts, do we have any type of performance clause that we could cancel the contract if the food is not to the quality that it should be, or what do we have to protect us?
Yeah, and there is. I consulted with the county attorney on that. Yes, there is. There's something in the food contract specification, I believe, that states that. Yes, I think we have to give the caterer a 30-day notice, and the caterer, if they decide to cancel us, we have to get a 120-day notice.
Any other questions?
Ms. Weemoff, I got a
Yes.
quick question.
Okay.
So down here it says 175 to 200 seniors per day.
Right. It is.
How does that vary? I don't understand that.
Oh, okay. At the Congregate Mill site, not everybody goes 5 days a week. They order a meal on the days they know they're going to come. With the home delivered meal program, again, you're dealing with the very frail seniors, and there is never everyone getting a meal on the same day. Ms. Smith may have a doctor's appointment. Mr. Smith may be in the hospital. So-and-so could be in the nursing home. You never have a completely full route every single day. That's just how it is. And they have to be home to get their meal. I need to state that, yeah. So if someone has a doctor's appointment at 11 o'clock and their meal will be delivered between 10:30 and 11:30, they should not be getting a meal that day. They have to be home to receive their meal. That makes sense?
That's good, thank you.
Okay.
Mr. Chairman, I have one other question.
Mr. Long.
Brought, talking about the meals. There's two questions. Do we have a
Okay.
waiting list?
We
for
do.
people?
We do. It probably, we have about 30 maybe, 30 to 40 maybe on the waiting list right now.
And
And-
meal delivery, is that just Monday through Friday, or is
It
it
is.
7 days a week?
No, it's Monday through Friday. And our standards, because we get federal and state money, requires that a route not last more than an hour, and there can be up to 14 meals on that route. So anytime you add someone, you've got to make sure you're within that 1 hour delivery time, and that you're not exceeding that 14 meals that you can deliver in an hour. And we're monitored by COG every year to make sure we're going by the standards.
And deliveries are by volunteers, is that correct?
Yes, we have, this is a big, want to compliment our volunteers. We have 15 home-delivered meal routes in Stanley County, and most routes are handled with 2 people. They go together. So on any given day, we've got 30 volunteers that are using their own car and their own gas to deliver meals. So it's an awesome group of people. It really is, and I can't say enough kind things about them.
And I would just say that that's one of the important pieces of this program is the volunteers, and we rely on them so heavily.
Oh, we
One of
do.
the critical pieces of this program is making sure the meals are delivered timely, because if they're not, then volunteers, it backs the volunteers up, and it could affect the ability of volunteers to continue to participate in the program. So there's a lot of things that have to line up with this program.
There is.
It's much more complicated because of the regulation that we have with respect to COG, which is federal money that comes from DHHS. So just
That's
a
correct.
note that there could potentially be unintended consequences as associated with not being able to meet the needs of getting the food on time each day.
Yeah, that's absolutely correct. And some of the volunteers work during the day, but their company is able to give them an hour off and maybe a little more than an hour to deliver meals. So, yeah, if we had to pay people to deliver meals, this program would just be outrageous. you know. And we have routes, as I said, 15 routes, and some of them go from Albemarle out to Meisenheimer. We have a route out there. So they go out in almost all areas of the county.
Mr. Chair, I'd like to make a motion
All right.
that we accept the Golden Corral of Lexington caterer for 2 years at $4.30 a meal.
There's a motion on the floor to accept the Lexington, North Carolina Golden Corral as the caterer for the next 2 years. Is there a second? A second from Commissioner Furr. Is there any other discussion?
I just want to ask 2 questions.
Sure.
Is Golden Corral doing this currently? Like, do they serve any other counties in the surrounding area?
They are currently doing the Meals on Wheels program in Rowan County, and that program is about 230 meals every day, where ours is 175 to 200. They've also bid on Davidson County Nutrition Program, but they've not yet decided.
So they'll have the capability. I mean, we're a good distance away from Lake, especially when you come
You know what, and
climate weather and stuff. So that was my only concern.
all I'll say is for 6 years, we had Punchy's Diner in Concord, and Punchy's traveled about 40 minutes to get here every day, and Golden Corral will be about 12 minutes more, 12 or 14 minutes more.
What was the previous bid? Just, I can't remember.
The $445.
Is what we were paying previously? the
Yes, for
Punches?
6 years, actually. They never went up on their bid
So that's.
for 6 years. Yeah.
Any other discussion? All those in favor, please say aye.
Aye.
Any opposed, no. Motion carries 6-1. I vote no.
Thank you.
Sorry, turn my mic off. Number 3 on the agenda tonight is the community-based water extensions. Mr. Wingo? Wingo?
Thank you, gentlemen, ladies. The Community-Based Water Main Extension Program was instituted in fiscal year 2018-2019. A deadline for the application submittal was January 31st, 2019. The purpose of the program was to address residential requests for public water service. Applicants were required to complete the application form and acquire signatures from neighbors within their community also wanting access to public water. They were to provide a map of the requested water main as well as getting signatures from neighboring property owners. We had received a total of 6 applications to be reviewed. The applications are listed by the road names as follows: Frog Pond Road, Vickers Store Road, Kirk Road, Tyson Road, Coley Store Road, and Webb Road. All water main extension applications submitted did exceed the program's stated financial limits of $500,000, except for Frog Pond Road, which did propose several water main extensions of various lengths. The application for Webb Road was submitted via a different format than the others that were submitted. None of the applications achieved the 80% threshold for property owner commitment to connect to a water main after construction by purchasing a tap and paying for the monthly bill. 2 areas where the highest percentage of community participation were Coley Store Road and Frog Pond Road at 71.4% each. The Stanley County GIS Department has produced more detailed maps that have been included with this presentation. An engineering estimate for each project is included with the attached GIS maps. Based on the information, 3 of the areas, Kirk Road, Vickers Store Road, and Tyson Road, are recommended to be rolled into the Phase 4 Water and Sewer Authority project that is currently in the planning stages. Based on available funding at this time, it is recommended up to 3,000 foot of water main extension along Frog Pond Road be constructed. Additionally, it is recommended the board continue to allocate sufficient funding on an annual basis to continue the water main extension program up to 3,000 feet per year to serve additional areas without incurring debt in the Stanley County Utilities Fund. We ask that you please review and consider the approval of the recommendations presented for the Community Water-Based Extension Program. Thank you.
Thank you, Mr. Wingo. Just to clarify, you're recommending 5,000 foot,
3,000, sir.
3,000 foot on Frog Pond Road?
Correct.
Okay.
And we had put that in the upcoming fiscal budget to fund that in an operational fund.
Okay. County Manager?
Just want to clarify, there were some funds included in this year's budget, but because it's taken us this long to kind of get this organized, it's not going to, those funds aren't going to be, you're not going to be able to, you're going to have to engineer this project. So by the time it gets engineered and the PER is done, which is the environmental review by the state, by the time you let this contract, it's going to be next fiscal year. So, so anyway, I just want to clarify this.
Thank you. Are there any questions?
Mr. Chairman, I do have one. Mr. Wingo, what percentage of residents signed up on Webb Road?
Well, what we received on Webb Road was an Excel spreadsheet that the lady that did the petitioning contacted the GIS department and got a list of properties with structures between her and the ending point of our water main. So with that being said, we didn't have any canvassing of the neighborhoods or any neighbors that actually signed up for a water main extension along Webb Road. As part of the process that was instituted by the previous director, the applicants were to solicit neighbors in their neighborhood, get them to sign up and produce a map. What I got for Webb Road was an Excel spreadsheet. It was submitted before the deadline, but it was not in the same format as the others. All the others did submit maps and did canvass their neighborhood to get people to sign up for water main extensions if they were interested.
Where would they have received the maps to submit them?
They could have gotten them at our office, and I believe there was a lot of notice sent out. Keep in mind, I came on board in November. This was instituted, in the fall of 2018. I'm sure Ms. Davis did some communications to the community about the requirements of this program.
And in our packet, there's a Stanley County Utility Community-Based Small Main Extension Project application.
Yes, sir.
Who fills those applications out?
They were available. Like I said, I don't know what had went on before. I was to receive them January 31st.
But who is responsible for filling out these applications?
I'm sorry, sir. The property owners, all the ones that applied, there was one, I guess someone took the lead within these communities, and they went out and solicited the neighbors to see if they're interested in getting public water along those roads.
How would they know the project cost, though?
They wouldn't. But the project cost was.
I guess what I'm getting at, this application, they're asking questions on here that if I were filling one of them out, I could fill out my name, my physical address, my phone number, but that's about as far as I could go.
Yes, sir. That is correct.
So,
And I hope moving forward that we'll put some things into place to try to get a little bit more information out to the public. Just keep in mind, I'm trying to work through what we had here and doing the best we can to try to make it work for this year. Moving ahead, I have some alternatives I'd like to present to you with regards to getting on a waiting list and having people informed of what is required and being able to fund this without going into significant debt in our utilities operation fund.
and I don't want us to go into debt, but looking at these maps, it looks like Webb Road is the least expensive, but yet the forms were not filled out that were requested.
Yes, sir.
And we don't know the percentage. And,
We don't.
And I do know that the lady that's asked about this, maybe we need to ask her for some direct input.
Yes, sir. I'm well up with that, but as I'd stated earlier, moving forward, we'd be happy to put her, on a new program at the start of the list. We may not get to her in year one because she's greater than 3,000 feet, but we can look at, the people that are, did not get served as part of this process and try to move them at the top of the list. The recommendation that I'd made on Frog Pond Road primarily had to deal with the fact that since they all exceeded the parameters I was looking for a water main that could help us get redundant feed back into Locust, who is our biggest customer, and also benefit customers that did make an application.
Commissioner Barber?
Yeah, I was looking at this too. On the Webb Road area, we have 26 properties with structures on 11 vacant properties. On Frog Pond, we have 21 properties and structures with 21 vacant properties. So even though there's only 15 signatures there, I don't believe that the applications were available or she didn't know about them, because I know this lady also. And from the way I have heard from years and years past, that she had quite a few names that were signing up for water. So I would love to research that before we make a decision.
Yes, sir.
I think that area would be, especially since it's at less cost and serve more customers.
Yes, sir, and I did speak with the county manager this morning concerning Frog Pond Road. We are actually looking at a potentiality of putting it in Phase 4 with the other ones. We have to explore the financing because it's something you have to negotiate with USDA. If that is possible, and we could potentially get Frog Pond Road rolled into the Water and Service Authority Phase 4, then that 3,000 feet or that money would be freed up for another project. That is a possibility, but that just came to light this morning after I received the information from Chambers Engineering.
County Manager?
I want to make sure the board's clear too. On Frog Pond, what Mr. Wingo is recommending is 3,000 feet,
Correct.
which is not the full project. It's just
Correct.
3,000 feet, because that's really all we have the money we can afford. If you go any more than that, you're really going to have to take on debt, and then you're going to have a debt service payment, which is going to then force you to potentially, you're going to raise rates more than you already have to raise rates to keep up with our system and the repairs and the maintenance and everything else. With Webb Road, if you were to serve the property that I think you all are questioning, you would have to go more than you're going to have to go way
Yes,
more
to
than
get to the
3,000
property
feet.
owner, I believe, I don't have it from this, over 7,000 feet.
So
6,400.
So you're going to incur at 623. You don't have enough money to do that number of feet. So you're essentially putting yourself in a situation where you have to incur debt. If you just did 3,000 feet on Webb Road, that petitioner would not get served initially. It would be, maybe the next year you would go another 3,000 feet.
Potentially,
It would probably
yeah.
take 3 years to get there if you just went 3,000 feet at a time. If you do the whole project and go the whole 8,000, basically 8,000 square feet to serve that property, the estimated cost of 623, you're gonna have to incur debt, a
Correct.
debt service to do that, which, one could say, well, we've got money in the budget to pay that debt service back. That's true, but then you're tying up that debt service for 2 or 3, 4 years before you can do another project. So just keep in mind how you're gonna structure this so that you don't incur debt. So I'd be happy to answer any questions. I know Mr.
One other question. Do we know whether or not the wells in each area are good wells or contaminated wells?
No, we don't. I mean, we know where areas within the county have a higher percentage of arsenic. It's generally located on the eastern side of the county, but individual wells, it's hit and miss, depending on, what you get when you drill. You can get good water, you can get bad water.
Thank you, Mr. Moore. Are there any other questions? Chairman? Mr. Jordan?
For those that have been on the board longer than me and been more heavily involved, Commissioner Barber, Commissioner Lawhorn, you guys seem to have a little more knowledge here. I'm going to go out on a limb and say the Webb Road's been requesting this for a long time. How long are we talking? So a decade? Okay, so all of these have been requesting this for a long time.
Correct.
Okay. Because I mean, I know we can't do all this in 1 year. If we're going 6,500 feet, that's at least 2.5 years or 2 years plus to get to it. But you got 26 properties with 11 vacant versus 21 properties with, let's see, 21 properties
Yeah,
structure.
it's hard to decipher that. Some roads have larger tracks, some of them
Yeah.
have smaller tracks. There's,
At mass, hard to tell.
Exactly,
Where you're getting
yeah.
your best dollar per dollar or dollar
Correct.
per head.
Frog Pond Road is 9,949 feet.
correct.
Webb Road is 6,446, 7,790 feet. You said, you're talking about doing Frog Pond, but we can only do 3,000 feet,
Correct,
so we're not doing all of Frog Pond.
correct. If that is true, but as Mr. Jordan alluded to, there's different variants in every scenario. The reason I had selected Frog Pond was just because, as an engineer, I'm looking for redundant feed to our biggest customer. If we have an outage on 24/27, it's a bad day, we could be in the press. Any sort of redundant feed we have to try to mitigate outages on 24/27, that to me is, as an engineer, is a priority. Yes, sir.
Mr. Barber? If that's the case, how many years will it take to complete that water line to have redundancy? Because you
Well,
can't get it to start
what I'm
with.
proposing to do, as I alluded to earlier, is try to get Frog Pond Road rolled into the Phase 4. If we can do that, the whole section of Frog Pond Road would be done, and then this money would be freed up in our operating budget to go to another project, whether it be Webb Road or Coley Store Road, because the rest of them will be in the Water and Sewer Authority, and we're going to petition the Water and Sewer Board very aggressively to try to get this done.
You know, if's a big little word.
Yes, sir. Yeah.
So if you were to, if that were to happen, when would you know?
We're meeting in May, and Mr. Chambers will be giving a presentation. What we'll do in May is a preliminary engineering report. If that goes well, then we'll proceed ahead. At that point, we have to get into negotiations with USDA to determine the funding, because they can't offer up to a 45% grant funding of these water mains. We've ran some preliminary numbers. We believe we'll pick up 582 customers. Total cost will be somewhere around $9 million, but from a revenue standpoint and just variables such as how many people will pay availability fee, how many people will connect on, we think it's doable.
You would know by June.
By June, probably. Yes, sir.
And if you were able to roll
Frog
Frog
Pond.
Pond Road into Phase 4, I'm assuming you would come back to us with
Yes, sir,
another report,
definitely.
just like this, minus Frog Pond Road, and we would reallocate this money we're talking about now towards selecting another one of these
That is
properties.
correct.
Commissioners, I would, personally, I would encourage someone to make a motion to table this until after that decision is made, because that decision could be made as early as May, probably as late as June,
Yes, sir.
before we approve a final budget. So I would encourage somebody to,
Mr. Chairman, I'll make that a motion that we table this until
And I'll second.
Phase 4 has been decided.
thank you, Commissioner Lawhon. A motion by Commissioner Lawhon to table this agenda item until a June meeting, seconded by Commissioner Barbie. Is there any other discussion? All those in favor, please say aye. Aye. Any opposed, no. Motion carries 7-0. Item number 4 on the agenda tonight is Utility Maintenance Management Service Agreement. Again, Mr. Wingo.
Thank you. The long-term manager director of the Pfeiffer North Stanley Water Association is retiring, and Pfeiffer North Stanley Water Association has requested Stanley County's assistance with providing utility management services and general oversight of operations on an interim basis. Attached, or please find attached, an agreement that outlines the various roles and responsibilities of each party and the financial obligation attributed to Pfeiffer North Stanley Water Association. We ask that you consider and approve the attached management services agreement.
What's the pleasure of the board?
Mr. Chairman,
Commissioner Morgan.
I move that we approve the management service agreement with PNSWA.
Motion by Commissioner Morgan. Is there a second? Second. Second by Commissioner Allman. Is there any discussion? All those in favor, please say aye. Aye. Any opposed, no. Motion carries 7-0. Item number 5 on our agenda tonight is the authorization to negotiate a special order of consent for the West Stanley wastewater treatment plant. Again, presenter, Mr. Wingo.
Thank you. Jimmy, you want to join me? I'm going to ask Jimmy Holland with WK Dixon to come up here when we get done. He can help address any more technical questions. The Stanley County Utilities Department has been in discussion with North Carolina Department of Environment North Carolina Department of Environment Quality concerning excessive sanitary sewer flow violations and discharge parameter violations at the West Stanley Wastewater Treatment Facility. To reduce impending fines and move forward with necessary facility upgrades without the potential for more severe actions, it has been recommended by NCDEQ that Stanley County enter into a special order of consent agreement, or an SOC. The SOC agreement shall be for a set period extending before and after the planned facility upgrades and will permit a reduction of NCDEQ fines associated with the permit violations. As part of the SOC approval process, NCDEQ and the Stanley County Board of Commissioners will formally agree to the terms of the SOC agreement. If requested, a public hearing may be required. During the SOC agreement term, negotiated sanitary sewer flow restrictions will occur at the West Stanley Wastewater Treatment Facility. Negotiated sanitary sewer flows allowed by NCDEQ will be allocated by Stanley County to the municipal users. The negotiations with NCDEQ are currently progressing, and it is anticipated that NCDEQ will allow for an additional allocated flow of 80,000 gallons and possibly more. Allowable flows will be increased upon construction commencement and after construction milestones are achieved. Upon completion of construction, the West Stanley Wastewater Treatment Facility will be permitted for 1.2 million gallons per day capacity. We are seeking a motion to direct staff as well as county legal counsel to work with NCDEQ to negotiate the terms of an SOC agreement in the best interest of Stanley County and to authorize staff to execute said agreement.
Thank you. Are there any questions from board members?
Mr. Chairman, I do have a couple questions here.
Commissioner Lawhon.
Our current flow per day, what the total flow per day right now?
We're at about 450,000 gallons a day on an average day. Wet weather, we're kind of all over the place. We're a little bit higher than that.
We're requesting 80,000 additional gallons.
The flow that you're actually requesting to negotiate with the state is, we have a process with the state. We're going to have to tell them what the plant is capable of handling. We've already gave them a number. We actually had the state actually did a site inspection on April 4th where they come and took a look at the plant and how it was operated. And we're in the process now, once we enter into negotiations, is how can we get some additional flow. They haven't given us a final number of what they have identified as the plant capacity is. While you're permitted for 900,000, we have to come back with them as what we thought that flow would be. And we haven't come to that term with the state yet, but that 80,000 would be in addition to what we come to that negotiated term would be.
And if you can get that 80,000 added, will that give us room for growth, continued growth?
It will give us room for some growth in Locust. I believe they have about that on the books that they really want to get processed and get going. I think there's more beyond that, but they understand what we're up against, and I think that number is something they could potentially live with.
Okay. And you mentioned fines. We're being fined evidently each day now, or for a period of time. How much are the fines that we're being charged?
It varies. It depends upon what the fine is for. You may be able to speak to this a little bit more as far as the total number you've had. I cannot remember.
We haven't
that.
gotten a lot here recently. They're holding off, and basically they're holding off because of the SOC agreement. Once we enter into the agreement, generally the fines will be lessened, but we don't know what they are. They are discretionary to some extent by the local NCDEQ office. They could be into the hundreds or they could be up into the thousands, depending on how severe they want to punish you.
And
By doing this, it would eliminate the fines?
it won't eliminate them. What we will do is once we enter this agreement, if there are potential fines that come down after, we will have negotiated those as part of our conditions, so they will be lessened to an extent. To what extent, we don't know until we get through the negotiation.
County Manager.
I would just say, normally when we get these, Commissioner Lawhon, they're a couple $1,000s each, whether it's Baden or for a wastewater treatment plant over the years. Unfortunately, we've had an an inordinate amount of rain. I mean, and it's not only put strain on our wastewater treatment plants, but strain on the collection systems of the various towns with their implementation and inflow. So until we started this process, we were getting fines and, on a pretty regular basis, in the several hundreds to low thousands that we would have to pay and settle up, both for, not only just for the Oakboro plant or West Stanley, but also for the Baden plant too. That certainly has had its share of fines. In a normal rain cycle, we're not seeing those issues, certainly at Baden or the West Stanley treatment plant. But with the amount of rain that we've received over the last 12 months, it's been a struggle for everyone involved in sewer operations.
Not just Stanley County.
Well, with the West Stanley wastewater treatment plant construction completed, fines should go away and our capacity should give us very big growth.
We should have the ability to grow once we get to 1.2, but let me, I guess, qualify that statement. The municipalities need to cooperate with reduction of their inflow and infiltration. There's still a tremendous amount that's coming in, even at 1.2. I feel like that needs to be addressed, and hopefully they're moving in that direction.
Any other questions?
Chairman.
Mr. Barbie?
The $80,000,
Gallons.
80,000 gallons, excuse me, per day, there's a chance that we may not get authorized that, right?
I don't think it will, we were going to get some flow. We're not going to get all that flow up front as soon as we sign the SOC. What will happen, they will give us a portion of that, and then it's basically, we will have conditions with the SOC. So once we go to bid for the new expansion, we will get another slot of flow. Once we get to a certain portion of construction, we will get another slot of flow. So that 80,000 is a number that we've kind of been talking about. We may get more than that, we may get slightly less than that. That's kind of the number we've been
That would be
talking
an
about.
initial
Nothing
number.
we've got in here is going to keep us from getting anything done, right? I mean,
No, sir.
County Manager?
And I will say that Dwayne and I have actually talked to Locust some too about the whole issue of Ferris County. And we want to make sure this capacity is not being eaten up by the Ferris County part of Locust. And maybe we weren't speaking for the board at that point. We were just based on former or other conversations we've heard. But I think this board's been, based on things you've said, is that you were concerned about that treatment capacity being eaten up by the Cabarrus County side. So we have had that conversation
Yes.
with Caesar about the fact that, and they're actually coming to meet with us later this week, Thursday, or we're going to see them to talk about some of this stuff. But we're with this limited amount that we're going to have, we want to make sure that benefits Stanley County to the utmost extent in terms of growth in our real property tax base. So. Any board members feel differently, or please let Dwayne and I know, but we've sort of kind of sticking to that to maximize the return on our investment.
And once we get through the construction, we will be past what you're actually permitted for now. So that number will once again be evaluated through the state with what the design capacity of those improvements would be.
Mr. Jordan?
You mentioned the municipalities needing to back down on, I forgot the first term you used, but their infiltration.
Inflow and infiltration.
Inflow being just simply how much they send in.
Well, inflow occurs as a direct runoff from a storm. If you have a 2-inch storm and water's running down the storm drains, there could be avenues to where it can get in the sewer system. Infiltration is caused by high water table. You have cracks around manholes and pipes that as the water table gets high, it seeps into the manholes, and it's a longer period event, where an inflow is more of an instantaneous event.
So the infiltration, we're looking at, is this, I don't want us to spend this money, spend this time, do this work, and then have some third party that we have no control over damage our system? Or, is there a way to hold people accountable, or to be sure they hit certain targets?
We do have our agreement, our treatment agreement with Oakboro, which is that does have probably the most significant I&I issue of the three municipalities that we serve. Not that Stanfield and Locust don't have, but probably from a size perspective. There are essentially financial penalties for going over a certain amount of I-9. And we've been working with them on those and trying to make them understand that they need to stay within those. We're working with them. We understand that, these are small towns and we don't necessarily want to break their bank, but they also have to be held accountable to making sure they're doing it. And Oak Borough my understanding is they've engaged an engineer and they are trying to address their issues. But I think a lot of it is this infiltration issue where the water table is just above their pipes and it's just finding every crack, because they didn't have this problem 2 years ago. I mean, they had I&I, but you didn't notice it to the extent you're noticing it today, because we're getting so much rain.
The water table stays high.
And the water table's so high. We actually had this issue where we had to go and make a manhole repair not too long ago, because we found out an excessive bill from Albemarle, but where we were sending I&I to Albemarle. And so we went in and made that repair, because financially, we couldn't continue to be sending that amount of non-sewer to them, and paying it. So, we incurred that cost to end that. So there's things they can do, but a lot of times it's so systemic across their system, it's hard to identify where it's coming from.
Any other discussion, questions? What's the pleasure of the board?
Mr. Chairman, I make a motion that we direct staff as well as the county's legal counsel to work with the NCDEQ to negotiate terms of an SOC agreement in the best interest of Stanley County, and to authorize the staff to execute said agreement.
Motion by Commissioner Jordan, second by Commissioner Barbie. Is there any discussion? All those in favor, please say aye. Aye. Any opposed, no. Motion carries 7-0.
Thank you.
Item number 6 tonight's 2018 Community Health Assessment Report. Mr. Jenkins.
Good evening, Chair, Commissioners. Hope everybody's doing all right this evening. All right, here to present to you all this evening our 2018 Community Health Assessment results. Every 3 years, we coordinate with our hospital, our local hospital here, to put this assessment together. And I do want to credit Ms. Debbie Bennett for her work on all this, our health educator here. She actually worked diligently on this 120-page document, which I will not be presenting all 120 pages this evening. Yeah. I know it would take all night to go through that, but also want to credit her. If you find any mistakes in here, I'll give her credit for that as well. But thank you, Debbie, for your support on this. So we'll try to get through this pretty painlessly. So purpose is to identify local health and community issues, community health improvement plans, allow us to obtain grant money, which is something we continuously work on with Health and Human Services. And the state says, thou shalt do it, so we have to do it. It's something that's mandated for us. A process, we have online and paper surveys that ran from January to February. And of those, we had about 917, 813 reusable surveys. So that's some of the feedback we received from the community. And that was the first of 2018. There were 5 focus groups, April through May. And you can see those listed there: Health Council, Small Business Center, Grounds for Business, Friends of Senior Center, and the Baptist Church Women on Mission. That's just try to get some well-rounded feedback in our community. Report components: quality of life, health issues, community issues, peer county comparisons, health profile, barriers to health and human services, emergency preparedness, focus group question responses, and identify health priorities. I won't be going through all this information. Just want to touch on some of this this evening for the sake of brevity. Survey headings, just basic overview, zip codes, gender, race, education, age, and marital status. So these are our leading causes of death. We're comparing the most recent data, 2013, 2017, to 2012, 2016, which is the previous data. So as you can see in their first three ranks, Stanley County has improved a little on the heart disease, cancer all sites, and cancer, trachea, bronchus, and lung. If you go down the list, you can see, I did want to point out all other unintentional injuries. Those would include any of your deaths related to opioid misuse or substance misuse, including both of those. So that's part of the reason why we have a slight increase in the rate there. Quality of life statements. These are some of the statements from the community. It's a great place to raise children, a great place to grow older, a great place to obtain health care, safe place to live, and lack of employment opportunities. Health issues rankings, 1 through 10, drug abuse, tobacco use, and obesity, overweight were the top 3. So I find it interesting if you look at those and go back to our leading causes of death. Heart disease is actually leading cause of death, but if you get feedback from the community, it comes in at number 10. So just interesting, just something to consider when you're looking at some of this information. The parentheses, and the blue parentheses is in numbers, rankings from 2015, so you just have something to compare to. So top 3 are still pretty consistent with previous health rankings. So health issues, Stanley zip codes, just kind of digging in a little bit deeper on the information based on zip code. You see drug abuse ranks at number 1, east, north, south, and west. Number 2, tobacco use is pretty consistent. Obesity, overweight comes in at 3, and then there's some changes between 4 and 5 between alcohol abuse, mental health, and there's a couple of cancer come in there as far as some of those issues for consideration being ranked by zip code east, north, south, and west. So some of the health issues that were discussed, I do not want to restart right now. That would be bad. To substance misuse, as you're aware that we've had overdoses in the community. In fact, Jennifer and I checked the data for March, and we were number 1 at rate again. So that's something we continue to address. We've got grants coming along. There's a lot more services being offered in Stanley County now that we did not have before. Jennifer's going to be talking about a grant we're trying to pursue later this evening to help continue to address this, and there's just an overall community partnership on tackling this issue. Obesity, overweight, access to healthy foods continues to be a concern, and we're working with our parks. We've got a lot of great parks and trails in the community, and we want people to get out and take advantage of those. Just stay active. Tobacco use, it's a big concern with vaping products in our middle and high schools right now. That's something we're having to look at as a community to address. And obviously, exposure to secondhand smoke is a concern. I'm involved in a lot with sports with my kids, and I don't like folks coming around smoking around the dugout and whatnot. I'll try to shoo them away, and if we have signs posted, it sure makes that a lot easier. So we'll be looking at some potential ordinances and policies, try and get in place through our Health and Human Services Board, and hopefully be able to present to you all at a later date. So stay tuned for that. Dental health, there's still concerns surrounding adult dental care. Not a lot of services for adults. Even folks that have dental insurance, you know how expensive it can be. So finding adult dental care is really tough in Stanley County right now. And that's been discussed a lot as well. Still have some high STD rates. Infant births, we have a high minority infant mortality rate. And we did receive a grant recently through the health department, Healthy Beginnings. So we're going to hopefully help tackle some of those issues with the high minority infant mortality rate. So some of the community issues, a little bit different now from health issues. Underemployment came in at number 1. Lack of inadequate health insurance was number 2. Bullying was number 3. And poverty came in at 4. I won't read all these off. I was actually surprised to see that bullying came in at number 3 because I've never had any issues hearing from my kids in school, but apparently it is an issue in our county in some areas. So again, issues by Stanley zip codes, just east, north, south, and west again. Pretty consistent on unemployment, underemployment. Bullying came in at number 2 in a couple. Poverty was number 1, number 2 in north. Access to adult daycare was number 2 in the west. You see inadequate or lack of health insurance once again show up, and poverty, crime, Access to substance treatment services, we hear that quite a bit. And you see that comes in at number 4 for South and West, tied for 4 and 3rd there. So some community issues discussed, lack of inadequate health insurance. There is a community care clinic that the hospital provides, deals with a lot of the chronic issues. And we were very fortunate to get a community health grant through the health department where anybody that doesn't have insurance can come and receive free health care, obviously based on income. So that's some positive things we're providing in the community right now. Higher education, according to 2012 to 2016 data, shows that 50% of Stanley County residents have less than a high school diploma. That was some of the data pooled there. Child abuse, obviously we have law enforcement, social services, the Butterfly House, Stop Go Tell through the public schools are some of the resources that are currently working with child abuse. Poverty relates directly to education level. We just made a statement that 50% Stanley County residents have less than high school diploma. Well, lower education means a higher poverty level. So, and that's based on the 2012 to 2016 data. Health disparities, lack of insurance, deductible copay too high, insurance not being accepted, like Medicaid, and lack of transportation. So some of the identified priorities by the health department is tobacco use, substance misuse, and overweight obesity. So mentioned some things we're working on through the health department, and there'll be more information coming forth on tackling some of these health priorities. Atrium identified priorities: obesity, mental health prevention and treatment, tobacco prevention and cessation, access to care, social and economic, which again comes back to food access. Again, the health assessment is report all 120 pages on the Stanley County website, the Stanley County Health Department website if you're interested in taking a closer look and a deeper dive in some of the data. Any questions or comments? Thank you all. Appreciate your time.
Item 7 will be the Rural Communities Opioid Response Program. Ms. Layton.
I'm a little more subdued tonight, Mr. Jordan, okay? Allergies have got me down.
I was going to ask if you can show the same enthusiasm you showed last time, this will be an amazing report.
I'll throw out some fun stories, maybe. So I'm going to try to keep this really, really brief because this is a really complex grant. I'm Jennifer Layton. Good evening to the board and the chair. This is a really interesting opportunity for us. Most of the grants that have been available on a national level related to the opioid crisis across the United States have been solely for planning purposes. And I have been arguably upset for several years thinking we didn't really need the planning assistance. We really needed money for programs and projects because we already had the capacity in the community to launch programs and projects. And so when this came along, we were notified like mid-March, and in true federal government fashion, it's due in 6 weeks, right? So we are under crunch time. So real quick, grant details. This is a federal grant available through the United States Department of Health and Human Services, the Health Resources and Services Administration. For short, we call it HRSA for communication purposes really quickly in our office. The Federal Office of Rural Health Policy. The funding would start September 1st of this year and run through August 31st of 2022, so it would be straddling a fiscal year, that last year, and of course throughout the period. The award total is $1 million, and $1 million sounds like a lot of money, and I was really excited about it until I started doing my budget. And I said, oh, $1 million goes really fast, and you all know that really well. There are 75 awards available on a national level. Otherwise, it really would not be worth our time to pursue. So here are some of the pros that I think you all will be interested in. There's no county matching dollars required, which is great. There's literally almost no unallowable cost. I classified this as a unicorn. This never, ever, ever happens in the grant world. Typically, you have a lot of limitations, a lot of ifs, ands, buts, and conditions, and ask for permission early on, please. That's not the case in this grant. Maybe because it's due in 6 weeks, I'm not sure, but it's magical, and we're really excited about it. All the money is given up front, meaning we're awarded, we have a $1 million check in hand by September 1, and we start work September 1. Also very unusual. It's not a reimbursement model, which can be cumbersome and very, very difficult for rural communities. Maybe that's why they've designed it that way. We are required to provide services to the uninsured. That is the primary focus of this grant. And to sort of put into perspective for you all, we were #1 in the state from June through October in 2018 for overdoses, and of those overdoses, between 65 and 70% were uninsured patients, men and women, meaning they typically don't get services and they have difficulty accessing services because they have more barriers and they tend to cycle back through over and over and over again, which costs the system so much more, including passing through the jail and the justice system, as well as tying up the ED. So here are some of our strengths. And it's like, here I go, Mr. Jordan, okay? So like I told the board last week, when I looked at the RFA, I didn't believe it. I thought that it was a joke because this never happens. And when I read it, I said, someone has bugged my office because this is literally what I've been preaching for 4 years. It's a comprehensive approach, top to bottom, across the board. We can't do one without the other. It's kind of like a 1,000-piece puzzle. If you do one piece, that's great, but then you hit another barrier when you're missing a puzzle piece, you don't see the whole picture. Does that make sense? And this grant requires that you are looking at that 30,000-foot view comprehensively. So we've been building a comprehensive response plan for 4 years, waiting for funding to come along for different puzzle pieces. And money has come and gone periodically, but a lot of times our county has not been eligible for funding from various funders. So we have to look at state and federal grants, truly. Most private foundations don't fund our zip code, which is very frustrating. We do have small community partners that really are ready to launch a lot of these programs and already have existing partnerships with people in active addiction out in our community and in recovery. As I mentioned already, our 2018 data is extremely dramatic, and that's no secret, right? We were in the paper quite a bit. Mr. Andrews has mentioned us quite a bit on the radio, but also qualitatively. And I'll just give you one example from a qualitative standpoint. It is not uncommon for me to get a phone call or a visit at the front desk of the health department from parents or grandparents with an adult child who has been to detox and treatment, and they've come home with prescriptions because now the state has encouraged medication-assisted treatment or therapy as a gold standard. They're uninsured. The average cost for that one prescription of Suboxone averages $300 to $800 a month. And, for a lot of these parents, that's probably their rent. And these kids they're not working yet. I say kids, they're adults, but they're not working yet because they've just come home from treatment. They're trying to get their life together and get a little more stable. But they typically have more than one prescription. They also are co-diagnosed often with a mental health disorder while they're in treatment. It could be anxiety, depression, bipolar disorder, schizophrenia, any number of mental health issues. And if they don't continue to maintain or manage that mental health issue, they will relapse really easily. So I'm left standing there trying to figure out if there are any resources locally, a safety net for mental health services and medications. And to be honest, there's not any. So I know when they leave our desk, they've got a couple days to get those medicines. And if they don't get those medications pretty quickly and counseling pretty quickly, they will relapse. And the likelihood of surviving a relapse is slim, depending on what they're using and how much they use, because their bodies are no longer tolerant to the drugs as it was before treatment. Does that make sense to you all? It is very difficult for me to say that over and over and over again to parents, but that's what I'm looking at. That's why this is such an important grant for us to pursue. I don't want to do that anymore. I want to be the, kind of like the movie, The Yes Man. I want to be the yes woman. I want to be like, yes, I have what you need. Yes, I can pay for your medications. Yes, I can cover your daycare when you go to counseling this week. No problem, we got it covered. Because we want to make sure they can sustain sobriety, because if they can get a year, that's huge. And it's likely they'll maintain that over time. We are classified as a high needs area. If we were not classified as a high needs area, we wouldn't qualify to apply. So sometimes bad news is good news. Early on, I secured Duke University to serve as our evaluation team for 3 years. Since then, I have been in communication with HRSA, asking if that's an okay and appropriate relationship. They have come back and countered a little bit and said we'd prefer that you evaluate in-house, unless you were going to do a project where you're designing a new a new tool or a new study, a new curriculum, something of that nature. So we're working on that. We're negotiating that right now. There's also potential to develop models for rural communities, and this is why I'm really proud of this grant. Allison Hudson has said repeatedly she wants Stanley County to be as the beacon of hope in North Carolina for recovery. I want us to be the beacon of hope in the country. I think we can do it. We have the potential. We have caring citizens. We do have the capacity to develop creative and innovative models. And so I would love for us to generate some of these innovative approaches that no one else has thought about and that can be uniquely done in rural areas. So here are some of the primary objectives myself and my partners have come up with. We want to strengthen our prevention efforts using our existing coalition. And we're partnering with the Center for Prevention Services in Charlotte, who has 30 or 40 years of experience in prevention efforts to help with that. Continue to eliminate the stigma related to substance use disorders. We want to prevent future overdoses, fatal and non-fatal, by providing peer support services and recovery support. We want to remove every barrier possible to care for uninsured men and women. I don't want to ever have to tell somebody no for the life of this grant. I want to make sure they can get the care they need, because if we can reduce the number of folks that are relapsing or in active addiction, it saves us money as a county overall. We want to improve the quality of counseling and therapy services, and this is a really interesting opportunity for us to partner with a unique nonprofit counseling service who said that the current recommendations are allowable billable services by Medicaid for post-treatment therapy services is inadequate. They just start to scratch the surface when Medicaid says, okay, you're done, you're maxed out your number of counseling services. So our hope is that we can show, maybe through a third-party evaluator, that additional counseling services are more effective at sustainable recovery, because that's going to be critical going forward. We also want to build a community that supports the sustainable recovery model. And we have Delton Russell, who's the new executive director at Will's Place. He has over 10 years of experience building recovery communities. And so we know that we have opportunities there and a lot of wealth of knowledge and experience coming to the community. So this is the quick projected budget. This is what I came up with in my head. We're hammering out details now because HRSA is fun and complicated. So we projected originally around $150,000, and that was a rough quote from Duke University for evaluation services, around 15%. And again, that's probably going to change significantly since HRSA countered my question and said, we'd really prefer that you do it in-house. And I said, okay, well, I studied all this stuff in grad school, but it's been a little while, but I'll do what you asked me to do. We want to put as much as we can into behavioral health services and medications because that's the largest barrier at this point. It's also required. This grant requires, well, I shouldn't say requires, it states that you are not allowed to deny services to anyone for the inability to pay. So no one that's uninsured can be denied service. So a large portion of that is going to be required to cover those services. Personnel, we have to have capacity. The small nonprofits that are coordinating these services will need one staff person each to coordinate the actual programming. Transportation is the #1 barrier in Stanley County to getting back and forth to care, whether it be to the recovery services, to counseling services, or to medical care, and vice versa. And so we need to be able to provide them transportation over the next 3 years. And then the last piece is programming. And programming will be various things. It will be, yoga, meditation. It will be teaching folks in recovery how to sustain recovery through developing coping skills, positive coping skills, so they don't have a risk of relapse, things of that nature. And also sober housing as well. I should also mention that. And so for right now, that's where we stand, but it's being modified daily. So just bear in mind that it changes every day. That $1 million is getting moved around a lot. I think the two things the three pieces of the puzzle that won't move much are behavioral health services, personnel, and transportation. Just because we have to get people places, we have to pay for personnel to coordinate the actual programs, and we're required to offer the services. Any questions?
Any questions from the board?
Mr. Chairman.
Mr. Morgan?
I've got 2 questions.
Sure.
First question, I guess, is you said that certain places don't fund our zip code. Why is that?
Debbie Bennett, I call us the black hole. If you look at foundations, we have spent so much time looking for funding for projects like this, all across the state, and more across the state than the national level, just because people want to fund usually within their. If you look at private foundations, they usually want to fund only within the county where they're located. So we don't have a lot of foundations that fund large-scale grants in our area, and to really make some of these things operate, and as you can see, it takes a lot of money. And so we've applied. We've called Kate B. Reynolds. They didn't want to fund programs. They wanted to fund planning or technical assistance, which wasn't helpful to us at the time. We've contacted Levine in Charlotte. You have to go to their board. They never call me back. So we've chased it hard trying to find funding. And for whatever reason, I think it's just because we're not considered metropolitan. We're rural. So we don't really fall under Cabarrus and Mecklenburg and Union. But we're also far enough away from some of these larger areas that we get overlooked. But a lot of rural communities do. So that's the only explanation I really have.
This just blows my mind, especially with our rate that
Yes.
we wouldn't fall in somewhere.
Yes.
And my only other question, I guess this is, I hearsay of, like, when you mentioned in the medication part, like Suboxone and stuff like
Yes.
that. Now, you're the expert, so I've heard basically once those folks get on it, they don't ever come off of it. Is that true, or do they wean them off like with it? I've just heard that once they're on it, they don't ever get off.
So
I know that can drive costs through the roof like that.
Yes. So here's our perspective, and we've chosen a counseling service specifically for this reason. We were having in-depth conversation with them 2 weeks ago to assess if we wanted to partner with them or not. So our philosophy on MAT treatment is that it's not really intended to be lifelong. It's really intended to help someone build their coping skills and build their capacity and their confidence in themselves to sustain recovery. It's almost like a teddy bear. Like when you're trying to teach your kid to stay in their own bed, you're like, okay, but you can have your teddy bear in your blanket, and you're gonna be okay, and then eventually they outgrow that. So the goal is, because the provider, it could be a primary practitioner, it could be a psychologist or something in mental health, is prescribing, but they are required to have that patient attend counseling services. Now the state has, said this is the gold standard, there's questionable practices happening because people are making a lot of money off of these prescriptions. Does that make sense? Yes. Yes, absolutely. And they've appropriated so much money to the MAT treatment model. So it gets complicated. When you ask individuals out in the community, the recovery community thinks that MAT is a useful tool if it's used appropriately, and research says that's true. But like you said, you really don't want them to stay on it long term, one, because it's expensive, and two, we want them to be able to build their own personal skill set to sustain their recovery long term and know they can do it on their own. Now, for this grant, we would have to develop criteria on how long we could afford to support someone's mental health meds. So it may take 6 months because you're trying to get them a job and get them hopefully. And I think because there is the projection that Medicaid expansion is coming, probably during the course of this grant, I'm willing to bet some of these patients will be able to start rolling onto Medicaid as it changes and transforms the next few years, which could also save us some money. That's going to be part of the actual sustainability plan, is to hope that starts to happen so that we're actually reducing some of those costs over the next 3 years.
Any other questions, comments?
Mr. Chairman, we spoke before about this. You were kind of excited about Duke doing the 3-year kind of review. Why does HRSA want us to do it internally?
So HRSA's response to my question was, if you can't do the evaluation yourself, we have a technical assistance person. And I said, just one for all 75 projects across the nation? And they said, yes. And I said, okay, well, if there's a potential that us allocating money for evaluation services could knock us out of the running, I'll drop it altogether, and I'll call TA if that's what they want me to do. I've had training in grad school on how to conduct evaluation on a basic level, and I'm assuming when they tell me evaluation, it's just the data collection piece of it. I was looking as I presented to our board a few weeks ago, I was looking at evaluation as comprehensively, what was our efficacy of our programs and any innovative tools we've created so that we can inform new models across the country, because that would be ideal for me. So, but I have to play their game, and I'm happy to play their game if it gets us services.
Any other questions?
Chairman, I do have one. You said this money could be used for just about anything.
Mm-hmm.
Can you use it for rehabilitation of a person that's addicted to drugs, that don't have the money to go to a rehab?
Yes. So I think I had asked Dave's assistant, Terry, to give you all a copy of the core activities. These are if it's not in your packet, I can have Tyler email it out to you. But these are the required core activities we have to complete. We're already doing a large portion of these. And some of these are just provider trainings that we can coordinate through North Carolina Department of Health and Human Services, which are easy check boxes, no problem. But yes, part of the required core activities is actually providing access to detox and treatment. And so we can pay for the application fee, we can pay for programs to cover, a 3 or 6 month treatment program if needed. I will tell you this, we will be extremely fiscally responsible with the money because I want to impact as many people as possible. So our partners have established relationships with treatment facilities all across North Carolina, South Carolina, and some surrounding states. And so they have programs they prefer to work with. Many of those are faith-based and don't charge anything except an application fee of a few $100s. And then with the transportation, we can have their staff drive them there and bring them back home when they come back. So we are going to be, I want to make sure we can get as many folks in as possible. So we're going to be extremely fiscally strict and sound with this money. I don't want to run out in year one. We have to balance ourselves. Does that answer your question?
Mr. Chairman, I'd like to make a motion that we approve Jennifer to go chase this grant.
Motion by Commissioner Jordan, a second by Commissioner Morgan. Is there any other discussion? All those in favor, please say aye. Aye. Any opposed, no. Motion carries 7-0.
Thank you. Hopefully we'll have good news in a few months.
Thank you, Chair, Commissioners. First, thank you for supporting us on this endeavor. I hope we can get this and make some good things happen. Another thing I want to point out, I was in error earlier tonight, and I wouldn't be able to sleep tonight if I didn't make this clarification. I stated that 50% of our population has less than a high school diploma. It should have been 50% of our population that is in poverty has less than a high school diploma. That's pretty important, so I want to make sure I point that out. My apologies, and thank you again.
Item number 8 on the agenda tonight is the resolution for a National Day of Prayer here in Stanley County. I don't have a presenter listed, so would someone care?
Mr. Chairman, I think that would be me.
Mr. Lawson?
The National Day of Prayer, we've been doing this for a number of years. Matter of fact, this year will be the 68th consecutive observance of the National Day of Prayer, and it's on May the 2nd, 2019, and this has been mandated by both Congress and by our President, and that the National Day of Prayer, the theme this year is Love One Another, which, by goodness, we sure need to do that in the United States, that's for sure. And whereas the leaders of our nation and our Stanley County community have relied upon the power of prayer throughout our history, and we therefore, the Board of Commissioners, do proclaim May the 2nd, 2019 as the Day of Prayer in Stanley County, and we encourage citizens to join together in their homes, places of work, places of worship, to pray for the unity of our hearts of all mankind, and to continue in prayer for Stanley County and our state and our nation. And Mr. Chairman, I would like to make the motion, if I'm in line, to make May the 2nd, 2019, and approve this proclamation as the National Day of Prayer.
Motion by Commissioner Lawson, a second by Commissioner Morgan. Is there any discussion? All those in favor, please say aye. Aye. Any opposed, no. Motion carries 7-0. The county attorney has passed me a note that says we need to remove 2 items from the consent agenda. Those items are E and F, records retention schedule for the Greater Baden Water Sewer District and the records retention schedule for the Piney Point Water District, and address those items individually. Can I get a motion to pass the consent agenda with the exclusion of those 2 items? Motion by Commissioner Barbie, is there a second?
Second.
A second by Commissioner Almond. All those in favor, please say aye. Aye. Any opposed, no. All right, I will make item number 10, I'm sorry. I have to now have I'm going to walk us through this as carefully as I can. I need a motion to recess the County Commissioners meeting and enter the Greater Baden Water and Sewer District Association, district meeting for the purpose of voting on records retention. Is there a motion? Motion by Commissioner Lawhon. Is there a second? Second by Commissioner Jordan. All those in favor, please say aye. Aye. Any opposed, no. Motion carries 7-0. We are now in a meeting of the Greater Baden Water and Sewer District. I will seek now a motion to approve the records retention schedule for the Greater Baden Water and Sewer District. So moved. A motion by Commissioner Morgan. Is there a second? Second. Second by Commissioner Almond. All those in favor, please say aye. Aye. Any opposed, no. Motion carries 7-0. I will now seek a motion to adjourn the Greater Baden Water and Sewer District and reconvene as the Piney Point Water District. I can't do both. Oh, you're killing me. I can't adjourn and convene in the same motion? Okay. Okay. Motion to adjourn the Greater Baden Water and Sewer District by Commissioner Jordan. Is there a second? Second. Second by Commissioner Almond. All those in favor, please say aye. Aye. Any opposed, no. I will now seek a motion to enter the Piney Point Water District meeting. Is there a motion? Motion by Commissioner Lawhon. Is there a second? Second by Commissioner Jordan. All those in favor, please say aye. Aye. Any opposed, no. Motion carries 7-0. We are now in the Piney Point Water District meeting. I will now seek a motion to pass the records retention schedule for the Piney Point Water District. Motion by Commissioner Morgan, second by Commissioner Almond. All those in favor, please say aye. Aye. Any opposed, no. Motion carries 7-0. I will now seek a motion to adjourn the Piney Point Water District meeting. Motion by Commissioner Jordan, second by Commissioner Lawhon. All those in favor, please say aye. Aye. Any opposed, no. Motion carries 7-0. Now I need a motion to reconvene the Board of County Commissioners. Motion by Commissioner Morgan, second by Commissioner Jordan. All those in favor, please say aye. Aye. Any opposed, no. Thank you all for helping me through that. That brings us to the public comment. Nobody signed up this evening. Does anybody care to speak? Seeing none, we shall go to board comments. I'll start with Commissioner Furr.
Thank you, Mr. Chairman. First off, I'm kind of disappointed that Ms. Weemhoff left before I got a chance to thank her and all the people that do the work for the senior citizens of the county. I didn't realize that all this was done by donation or by people that done their own gas. I am prepared, and I hope Ms. Tyler has a way to get in touch with her, that I would like to donate $200 to that cause. And if we can help them, I feel like one of these days I'm gonna be a senior citizen, and I'll probably gonna need it myself. Thank you very much.
Thank you, Commissioner Furr. Commissioner Ullman.
Yes, sir. I'd also like to echo Lane and commend the volunteers that do the Meals on Wheels. And second, went to the Butterfly House breakfast last Friday with Andy and Director Jenkins, and I'd just like to thank the work that the Butterfly House does, and Amy Yao specifically.
Thank you, Commissioner Ullman. Commissioner Morgan.
I just had, the NC Works Career Center here in Stanley County is having, a senior workers job club, I guess, career day. The third, evidently they do it the third Thursday of every month at 9:30. And it's for anybody 50 and over, who wants something like a part-time job. They can go. Actually gave this to Becky before she left. And since Mr. Eford's here, I will remind everybody to the Carrie Eford ride is last Saturday of this month. What time's registration?
9 o'clock.
9 o'clock.
Thank you, sir.
And that's it.
Thank you, Commissioner Morgan. Commissioner Lohan.
An update on residential home building permits, January through March of 2019. Total of 89 permits were issued, which is up 39% over the same period of 2018. And 2018 was a good year. Value total $12.4 million, which is down slightly by 4.1% over the same period of 2018. We need to encourage some more houses to be built down on Lake Tillery, because maybe that's why it's down a little bit. But those are good numbers. Our economy still seems to be good by residential home construction.
Thank you, Commissioner Lohan. Commissioner Jordan.
I was, had the pleasure, and I use that word loosely, of going to the Durham NAACC commissioner training last week, both for this board, and I stayed on because I'm on the Board of Health and listened to the Medicaid transformation convening training they had. And I was disappointed and pleased at the same time. I was disappointed to learn that no one up there knows what they're doing either. There are no answers, not a single one. But I was pleased to learn that the people that we had representing, Dolly from DSS, Andy as the county manager, compared to some of the people in that room, our people had their stuff together. They knew what they were doing. They knew the answers to questions. A lot of those people there didn't even know what questions to have. And our people have done a great job of educating themselves as best they can to respond to an upcoming problem that no one can tell us exactly how it's going to play out. And that stinks. It shouldn't be that way, but it is. If you're going to change laws and change the rules, those rules should be clarified so you know what you're changing and what the effects are going to be. Because there's certainly been a lot of them changed. You'd think someone would have done the work to let us know what the outcome, is that we can expect, but they haven't. So, thank you to our people in Stanley County, in the Health Department, Director Jenkins, Dolly Clayton, and her side over at DSS for all that they've done and for preparing us as good as they can for what we're about to face. And thanks to our Consolidated Health Human Services Board for putting up with me trying to help them come up with a solution for this problem. Thank you.
Thank you, Commissioner Jordan. Commissioner Barbie.
Since I'm last, that's ditto for all the other things that everybody said. I appreciate it, and thanks a lot.
Thank you, Commissioner Barbie. I actually have no comment tonight. If there's no other business, I'll seek a motion to recess until tomorrow evening at 6 p.m. in this room.
Second.
Motion by Commissioner Lohan, second by Commissioner Morgan. All those in favor, please say aye. Any opposed, no. Motion carries 7-0. Thank you all for coming out tonight and spending your time with us.